Good afternoon, everyone. My name is Dr. Adebayo. Welcome to episode 7 of You and Your Pet. Today, we'll be talking about rabies. Like, what is rabies itself? How does it occur? How does it happen? How can we prevent it? What are the roles of each and every one of us in preventing rabies? I will start with a story. There was a time, some years back, when a man brought a dog to the clinic. When he brought the dog to the clinic, he was saying, doctor, this dog is acting strange, he's barking at everyone. Even the children that I used to play with, he's not playing with them. It hasn't eaten for 2 days. On examining the dog, we saw that the dog was drooling saliva. It was barking at everything that he sees, any movement, he barks. He wants to attack, he wants to bite everyone. He was fearful, it was aggressive. So when we examined the dog, after much intense investigation, they had to go for this laboratory analysis. They got the brain and they tested for rabies. Immediately, it was confirmed that it was rabies. We had to tell the man, the owner of the dog, to go to a clinic because we noticed that during the process of the man handling the dog when it was aggressive, the dog has already bitten the owner itself. So the owner, we had to tell the owner to go to the clinic to make sure, to the hospital, to make sure he gets treated, to get post-exposure vaccination. So then this will now bring me to the topic itself. What is rabies? Rabies is a sickness, or let me say it's a disease that basically affects the brain. It affects the brain mostly, and it's seen mostly in dogs, cats, humans itself. It's not limited to dogs alone. So when we see this kind of symptoms that I've described earlier, you know that this is a classical sign of rabies. When we see all of this, we should know that this is a classical sign of rabies. And how do we know? How does it happen? It means that when it bites an unvaccinated dog or unvaccinated animal or an human that does not take care of what's it called when after an human got bitten, the person did not get to hospital. A rabid dog transfers the virus itself into that animal or to that person through the saliva. So let's look at it this way. The virus itself, let's look at the rabies itself. Rabies is a virus that it stays in the saliva of affected animal. It shields itself in the saliva of a rabid animal, a animal that has already been affected. So what are the classical signs that we see? We see that the animal is drooling, the saliva is aggressive, it stops eating, he's not drinking, he's barking at anything that it sees. Even people that the owner or people that are the handler can't control it. So such animal should be brought to the clinic so as to know if this is a classical sign of rabies or not. So in humans, you can see something like, you can see fever, see body pain, restlessness. But after the few days, the person begins to ask confused, afraid of water. So how does rabies spread? So rabies mainly is through bites. It is contacted through bite of a rabid animal. So once a rabid animal bites an unvaccinated dog, let me use dog in this instance. Once a rabid animal bites an unvaccinated dog, the animal itself, the virus inside the saliva enters through the open wound and enters into the body. This is where we see situation whereby we say, oh, it's just a bite wound and the thing has healed up. But what is actually happening is that the virus has entered the bloodstream, is finding its way to the brain, and because the virus attacks the brain, so even though it houses itself in the saliva, it finds its way around the brain. So weeks later, even after the wound has healed, we will see the person or the animal coming down with signs of rabies. What then can we use? How can we prevent ourselves? How can we prevent our pets? That's when we should come to the understanding of vaccination. Rabies can be reduced, can be completely prevented by vaccinating our pets. When we vaccinate our pets, when we make sure that all of our companion animals are vaccinated, dogs and cats, then by protecting the animal or the pet itself, you are protecting yourself in the sense that in as much as you vaccinated your dog or cat or other companion animals, you are protecting yourself. That means if a rabid animal or a rabid dog bites your dog, then your dog won't come down with rabies and your dog won't be able to transmit it to you or your children or the young ones that they play with. So that's why we advise that dogs are vaccinated in the community. That's why we advise that people make sure that they vaccinate their dogs, they vaccinate their pets. And when we come to think of it, the price of vaccination or the cost for vaccination of vaccinating your dog or your pet is much more than the cost which you will use when it comes to treating yourself after a rabid dog has bitten you. So what then should one do, or what then should one do when you notice that a dog that has been bitten that has rabies, a dog that has rabies bites another person or someone around you? The first thing you should do is to make sure that that wound is being washed under running water for at least 15 to 20 minutes and with soap and water. So when you make sure you wash the wound with soap and water, make sure you get to the nearest hospital to complain about it. And there are post-exposure vaccinations for humans. So just make sure you get vaccinated about it. So that's why we'll say that once you protect your dog by vaccinating your dog, then you are protecting yourself. Because when you make sure you vaccinate your animal, you are keeping yourself safe. The truth is that rabies can be prevented. It can be minimized. It can be prevented at all costs by making sure we vaccinate our animal. So that's why all hands should be on decks with pet handlers, with dog owners, with pet owners, with individuals. Let's make sure we vaccinate our animals. Let's make sure we vaccinate our dogs and cats against rabies. And as well, let's make sure that when we see someone or when we see signs of these signs that I've mentioned earlier, what are these signs? Like drooling of saliva, like aggressiveness, like fearfulness, like um the animal not running away from food or stops eating suddenly, stop drinking water suddenly, start hiding in dark corners. There are those signs. Once we notice all of those signs, we should make sure we report to the nearest hospital or veterinary clinic uh, that are near us. And one thing is that once you notice all of these signs and you notice that a dog that has rabies or that you are suspecting to have rabies beats another person, let's make sure we get the person to the nearest hospital so that they can get post-exposure. And before that, what first aid do we say we should do again? The first aid we said we should do is make sure that we wash the wound under running water for some minutes. After washing it under running water for some minutes with soap and water, let's make sure we get to the hospital and get post-exposure vaccination for rabies. So let's make sure we put all hands on deck for this, and let's make sure we come together to prevent rabies at all costs. Thank you very much. We are coming to the end of this show, and if you have any question, just make sure you put it down in the comment section. Thank you.